There are a few ways that EMTs, paramedics can run into legal trouble. It's not common that we get sued, but it is something that could happen. And one of the ways that we can run into trouble is if we are negligent. In order to prove negligence, you need four different components. One, you have to show that as an EMT or paramedic, you had a duty to act. So that means that you had some responsibility to provide care for the patient. Generally, this means that you were on call and you were dispatched to the call. If you're not at work, not at shift, you're off duty, you don't have a duty to act. Now, there's a perceived duty that you can run into, that if you are maybe out in public and you are wearing your uniform. So if you stop at the store to pick up something on your way to work in your uniform and there's an emergency, people see you, recognize the uniform, and there's a perceived duty that you should stop and help. Now, we never have to stop and help if something is going to put us in harm's way. So if there's not a safe place to stop at a wreck or it's a violent scene, then obviously we don't need to respond and take care of the patient. We don't have a duty at that point. Our duty is our safety. Now, breach of duty means you didn't do what you were supposed to do. And that could be that you didn't respond to the call, or it could be that you violated the scope of practice. And the scope of practice is what we are allowed to do, and that is defined by the state. So you're given an EMT or paramedic license, and the state decides that per that license, you can do certain procedures. If you do something outside of that, you have done something outside your scope of practice. Now, the third component to negligence is there has to be some sort of injury or damage. So somebody has to be hurt, the outcome has to be bad, and this could be both a physical thing or a psychological thing. So it's more than just you possibly injured the patient. There may be some psychological trauma involved with it. That's the damages. Now, the hardest part for it to be proven negligent is something called proximate cause. And this means that they have to prove that your actions or inaction, whatever you did to breach your duty, caused further injury to the patient. And that's not the easiest thing to prove. And I guess it's fortunate for us that most of what we do is not going to show, or it's going to be hard to show, that you actually made the patient worse than what they were. So you're pretty safe overall. But remember, you have to have a duty to act. You then have to breach that duty. There has to be injury to the patient. And lastly, they have to show that the breach of your duty caused the injury or made the injury worse.